If your hips are still hurting, there's likely a mismatch between your brain and the muscles in your hips, even if you're doing countless stretches, taking a bunch of painkillers, or icing 24/7. So in this video, I'm going to show you how to rebuild the brain-hip connection and start getting you on the road to healing from your hip pain. By the way, I'm Mike. I'm a chiropractor and a master's of science in exercise, and I help people reduce their hip pain, back pain, and knee pain all day, every day. It's all I do. So let's get started. Now, just before we get started, here's a quick disclaimer. All right, so for this first exercise, what we're going to do is we are going to lie down on our back and we are going to gently release some of the muscles in our legs and in our glutes and our bum, basically, okay? So we're gonna go on our back here. And this is great if we're kind of waking up and doing this in the morning, okay? So we're on our back here. And if our left leg is, or hip is the painful leg, we're gonna go right here. Then what we wanna do is lift it up and grab it kind of underneath right here, okay? And then as best as we can, straighten our leg and just pull it ever so slightly up till we feel a stretch in this part of our leg and a little bit kind of in the back part of our bum and our hip right here, okay? So we're just gonna pull up like that. Good, just nice and gentle, bring it back down and relax. All right, so we can do that hold that stretch for 10 seconds or so, let it go. Do that 5 to 7 times, and that's one set. You can do it another 5 to 7 times, and that's a second set. All right, that is the hamstring stretch exercise. Now, quick note, if when you're doing these stretches, all of them are meant to be relieving. So if we start to feel any sort of pain or the pain starts coming back, let's say before we started, we were at a 7 out of 10 on the pain scale, 10 being the worst pain we've ever felt, 0 being we're feeling absolutely no pain. If we start at, say, a 6 or 7 out of 10 and we're doing the exercises and we're getting up to a 5, we want to make sure that that's where we stop. We don't push through the pain. We don't want pain to come back. Pain is a good protective mechanism from our brain when it perceives that something is wrong, especially when we're doing a stretch, okay? So we should never push through the pain. If we get up to that 5, we just want to ease up and go to a place maybe where it's at a 4 or even a 3 out of 10, okay? And then if we are consistently getting to a 7 out of 10, that's where I would recommend stopping these exercises and going and seeing your trusted health professional because they may not be right for you. All right, so the next strengthening exercise we're going to do for our hips is an exercise known as hip bridges, okay? So what this is doing is sometimes when our hips are hurting or the muscles are sore, we want to be able to activate other parts of our body that are interacting with our hips. So one of those areas is the core, which includes our low back muscles that connect in with our pelvis and our hips, okay? So when we stabilize that area, that often can work against, in a good way, work against the pain that we're feeling in the hips from, again, that brain to hip mismatch, or maybe it's brain muscles mismatch, okay? So what we're going to do is we're going to get on our back for this, okay? And our feet are going to be flat on the table or the floor, wherever we're doing this exercise, okay? We're gonna go on our back, get nice and comfortable here, okay? Then what we're going to do first is we are going to not activate anything in this area just yet. We are going to kind of press with our feet into the table. So right here, just lightly pressing, okay? And then once we do that, we are going to then press together without moving them. We're going to press together the insides of our legs and the outsides of our legs, okay? So you'll also feel that back here. So we're going to go feet, legs. Then what we're going to do is bring our hips up like this so that it's almost a flat surface on a diagonal from our chin right to our knees, okay? So I'll show you the ideal position. So we're going to press feet, press legs, lift up. Stay breathing as we do this. Hold and then slowly back down. Just like that, nice and easy. And then relax from this area all the way down to our feet, okay? So we're gonna do another round. Press feet, lift up. Keep breathing while you're doing this. Awesome, then come back down. Now, one thing that when you are doing this, you can try with your breathing if you're feeling confident and this is making tons of sense or you're used to this already, is you can visualize, especially if you're just kind of lying on your back here, you can visualize when you're breathing your core expanding down towards your feet and up towards your chin. Okay, and then when you're breathing out, you're pretending that you're trying not to compress that part of your core. And so you want to keep it stable. You want to kind of expand it and then keep it expanded as you're breathing out. And what that's going to do is that's going to activate the muscles in between your vertebrae that also help with the nerve communication down to the muscles in your hips. Okay, so we're going to activate our feet, activate our legs. Breathe deep, expand down to the feet, then slowly breathe out and come back. All right. So you can do that exercise 5 to 7 times. That's one set. Okay. Then you can take a rest, do that a second set, and do that morning and evening. And that is the hip bridge strengthening exercise. All right, so the next exercise that we're going to do is we are going to open up again the muscles and the joint on the hip that's hurting. So if our right hip is the one that's hurting, we are going to do what's called the figure 4 exercise. So we are going to place our leg up here on our knee, okay? If we have difficulty with that, what you can do is you would just put your other leg kind of as low down as you can, then put the painful leg, the painful hip leg, on top of the other leg like so. Then just bring it up or roll it up as far as you can, okay? And then basically as far as you can bring it up, that's as far as you need to go, okay? Then whether we're up here or whether we're kind of down here, what we're then going to do is keep our back straight, so you can hold on to a chair if that helps, okay? The sides of the chair or something else. Just, we're not rounding our back. We're making sure that we're keeping our back straight. And then for me, this is where I would feel a stretch. We're going to just lean into it. And then when we get to a point where we should feel it kind of both in the back here as well as a little bit on the side, okay? So we shouldn't feel it in the other leg. We should all feel it kind of on this part if the right leg is where it's hurting and the right low back. We're just going to lean forward into it, nice and gentle. Good. And then if we want to even induce a little more of a gentle stretch or an exercise, we can turn towards the leg that is on the floor here and just hold. And that's a nice gentle stretch, okay? So we would come up. When we get down into the stretching position, we can hold that for 5 to 10 seconds and then slowly come back up. And we can do that 8 to 10 times. That's one set. And then we can do that for 2 sets, morning and evening. And that would be a good routine for this. All right, for this last exercise, we are going to do more of a strengthening exercise for those muscles that are controlling parts of our hip as well as kind of connected into our lower back. Okay, so what we're going to do is we're going to raise up our hurting leg or our painful hip, okay? Then we are going to turn it inwards ever so slightly once it's at the top, if we can do so, okay? So we'll go on our side like this, okay? Slightly forward, okay? Not directly on our other hip bone because that's just uncomfortable, but we can just kind of lean a little bit forward like this and brace ourselves with our arm. We would have a moderately straight leg. If it's easier to do it just like this with a bent knee, that's totally fine. But the most exercise comes from a completely straight leg, okay? So just kind of find what's comfortable for you. So what we're going to do is we're going to raise up our hip just like that. And then when we get to the top of where we feel like is the top of how far we can go, and we're just going to turn in ever so slightly our leg. Oh, that's a good stretch. And it's a good workout in this hip, okay? So then we would bring it back down slowly, not never dropping it down because that could cause another injury, right? We're going to lift it up, turn it in, and then back down. Whew. It's a good workout, okay? So just like that. So we can do that 8 to 10 times, one set, take a rest, do it another 8 to 10 times, that's a second set. For best results, what I often recommend is doing it in the morning and in the evening, just as kind of part of a routine. And that is the hip abduction exercise. So if you found this routine helpful, feel free to come join our community of older active adults who are maintaining independence and moving strongly with free movement tips, healthy exercises, and ensuring that they are living the best years of their life free of pain. Click the link below to join. And if you're ready to take your joint health to the next level, you can click this link here, where in this video, I show you how to incorporate essential lower body strength exercises to help your balance and maintain your mobility. You'll learn how to strengthen your hips, knees, and glutes in ways that maintain your joint mobility and help keep you strong for years to come. And so thanks for watching, and we'll see you in the next video.